Y'all remember last week I went to the doctor. I had been suffering from ear pains. I thought it was like an ear infection, sinuses. Anyway, they took blood. She looked in my ear. They did lab work. And I was still having pain. So
Okay,
I went
this
and
is
ordered this
from
thing and looked in
Timu,
my own
the
ear.
ear cleaner with the camera.
Because after taking the Sudafed, I was still having issues. Yeah, so she said it was seasonal allergies. And I was like, I've never had this before in my life. But we know our own bodies. And she had already looked in my ear. But I knew that something wasn't right. Okay, so these blue tips go on the end of the instrument. C charger. And these are all of the ear cleaning tools that aren't fibers that can be left inside of the ear. My only thing is, even though you don't have the fibers, sometimes your ears are wet. And that's why you use the cotton swabs. But out of 52 years, I've never had this issue using cotton swabs. Now, I have had where I can take a tweezer and get a fiber out probably once or twice out of my 52 years. But never this severe. And so I did order this from Temu. And I'm showing you everything that's in the package. And I'm going to provide the links if you decide to get one for yourself to look in your own ears. Because I do have an older one, but I couldn't find the and it was just a light and a camera. I couldn't find it. The
Okay,
piece
we
that
have
goes
to
with it.
download the ear app using this code.
Okay, so when you download this app and open it, it actually kind of like Bluetooths to your phone. So you can actually see the images on your phone just by using this app. Once you get it all set up, it's very simple. You go to allow, and then instead of using your house Wi-Fi, you just click on the earpiece Wi-Fi, and it goes directly to the images.
Okay, I am charging
But it
the
took me a little while to figure it out because I was
device
trying to.
right
It's
now.
plugged up charging, but once I unplug
Okay, it
it
says
automatically
long
works. So it
press.
took me a little while to figure
1,
this out.
2, 3, 4,
So that's why I can tell
5.
you it's very, very simple.
1, 2, 3,
You
4,
can't
5.
turn it on while it's charging.
1, 2, 3, 4, 5, 6,
So
7.
that's what I learned. So once you charge it up, that red light goes off, and it does not take long to charge at all. It does take videos and it does take pictures. You can choose your language. Of course, I had to choose English. A very simple app once you get used to it. This is me trying to figure it out. So I changed it from my home Wi-Fi to this ear thing. And once again, it has to be on. Once you unplug it, there you go. Now it's ready to download to your app. You see the ear, you go to the ear. Instead of using your own Wi-Fi, you use ear. So this is me still trying to play around with it, make sure I got it. But I had already got it and didn't realize it, okay? Okay, so this is the tip. You can see that it's working. So down in my ear, and I could see that white thing. Now, when she looked in my ear, she said it was my eardrum. But I could clearly see her eardrum might be white, but my eardrum is not going to be white because I'm a dark-skinned person. So that soft tip on this thing is soft so you won't damage your eardrum, but it is hard to pull stuff out with. I noticed. So like I said, I had been using Q-tips every day, like when I get out of the shower, because my ears are wet. So I'm thinking, like, should I put like swimmer ear things in my ear to keep it from getting wet? But obviously, it's you can sell it. It's not that much earwax because, like I said, and then my ear was kind of itching. Like I said, it does, but you can clearly see that white thing at the bottom of my ear. Clearly. And when I touched it, it crackled a little bit. Now, the doctor looked in my ear and she saw that, and she said that was my eardrum. My eardrum would never be Snow White because I'm not Snow White. So obviously that's a Q-tip that got stuck in my ear. And it's wedged in there because, every day I'm taking a shower. That's my routine. I'll take a shower, get out, put on my little lotion and stuff, and then I'm cleaning my ears out. So obviously I'm packing that in, not knowing it. But I'm thinking it's sinuses because my eye was running, my ear was like clogged up. I went to the doctor and she said, yeah, that's your membrane. It's water behind your membrane. I'm thinking, okay. I went ahead and took the Sudafed, and I was like, this is not working at all. And I was like, let me look inside my own ear. And when I seen that, right away I knew I knew what it was. So I went and put warm water in a bowl because I had a hair in my ear years ago. And I had to put like warm water in this irrigation bowl to try to get that out. I used oil in my ear and try to get it out. And I ended up getting dizzy. Couldn't get it out. And I tried for several days. But like I said, this soft tip, it really didn't work. The soft tip is too soft and it really didn't work. And then your eardrum, it kind of curves a little bit. So you really can't get to, you see how those curves are? You really have to angle it just right in order to get down in there. And since I had been trying and trying, my ear started to get sore. So this is my other ear. You see, this is my right ear. My normal eardrum is like a pink or, that's a clear eardrum. So if that doctor had just looked at my other eardrum, or she could have been funny. It's so much with us black people and these white doctors, first of all, not believing us. I honestly didn't know it was a Q-tip stuck in my ear. I don't know if she thought I was lying. I don't know what was up with the lady, but she didn't even look at my other ear, and anybody would have known that was a Q-tip. But anyway, so I tried and tried and tried to get this thing out until my ear got sore. And like I said, I tried with oils, and you see now it's wet. I tried olive water, make it slick to fall out. Then I tried to do water, make it slick to fall out, and it just would not come out. And I tried for days. So eventually, a few days later, my ear got sore. I ended up going to the emergency room. They end up trying to flush it out with like a peroxide water. I end up getting dizzy, and the lady was like, "You me try again?" And I was like, "No." So I actually came home from the emergency room, and I put another Q-tip, a longer one that I had bought from. I bought this from Big Lots a long time ago, and I had the idea to twist it in my ear, and it finally came out. But this is the olive oil. This was obviously compacted in there because I had just kept, cleaning my ears, not realizing this portion was stuck in there. I didn't feel it. I'm thinking I'm sniffling, I'm sneezing. I'm thinking it's allergies. And I had been thinking it was allergies for like 2 weeks. I made a doctor's appointment. I waited for 2 weeks. And it's so annoying because it's right there and you cannot get to it. You can see it, but you can't grab it. And so after all this time, I forgot a long time ago I had bought this clamper thing. But these few days, I wasn't even thinking about the clamor. I'm still trying to use this tool because I can see it, and I'm trying to figure out how do I get in there and just move it out. And I'm constantly making it sore. And you can see it's water and oil, but it's not moving. And like I said, after a couple of days of doing this, I had just gave up. But I was, the way I am, I'm so persistent, and I'm going to keep trying. Because I said, I know I can get this out of my ear. It's right there. I can see it. Up, and then, yeah, I tried it without, which is scary. Don't do this. I tried it without that plastic because that plastic tip was too soft to grab it. So I'm trying to figure out how to get this metal piece in here without damaging the eardrum. And then I'm trying to measure, like, how deep with my fingers, how deep can I go without going too far with the other ear. So I'm right there at it. And that actually hurt. Because that metal against your skin, not good. And then too, when I did go to the emergency room and she wanted to dig in my ear, I was like, no, let me do it. And the other doctor had already kind of like pissed me off, right? Because I went there, she looked in my ear, and she's like, that's your eardrum. So when I went to the emergency room, the lady came in there. She said, I'm a nurse practitioner. And I was like, well, can I see a doctor? And she pulled my ear. I am a doctor. Well, why would you call yourself a nurse practitioner? You know what I'm saying? So I heard her out in the hallway telling other people, yeah, and she was saying that I wasn't a doctor, and then she thought she was going to come in there and dig in my ear. So if they say nurse practitioner, that means doctor. Well, that's what she said. I'm like, are you an LPN? Because that's the only thing I know, LPN, RN, and doctor. I said, are you an LPN? She said, no, I'm a nurse practitioner. I'm the doctor. So, shoot, I didn't know. So I wasn't about to let that lady dig in my ear. But I did let this other lady who was acting like she was trying to be nice flush it out. And that same night that I went to the emergency room, I came home and got the idea to use the Q-tip, another Q-tip, to twist it and get it out. And then I used this clamper thing that I had. But this is just showing you guys, it took several attempts trying, like I'm trying to figure this out. And don't dig in nobody else's ear. You know what they need? They need the scissors. like, I can see this thing, but I just can't grab it. So if you want to just look in your ear, you can purchase this. But there is another, if you want to do your own, you know, how you say, abstractions, get it out. You want to get it out. There is another thing that they have on Amazon that you can like push in your ear and grab with, and it's thinner. But when I went to the emergency room, they did have like a clamper, and I couldn't get it out with that because it was so flat against the eardrum, and the eardrum can be damaged. I did try to use like this throat vacuum. Oh, and that felt like it almost popped my eardrum. So, but thankfully I didn't. So when I felt pain, I just knew to stop. When somebody else is doing it, they cannot feel your pain. So it was at 90%. And like I said, I was going at this thing for days. I didn't show you guys when I was using the water to flush it. I didn't show you guys where I was using the oils to lubricate it. So thinking it would just eventually just slide out. And then once you're messing with the ear, you get very dizzy. You get so dizzy. So I had to stop and continue at another date. And this time, after I stopped and flushed it, it moved. You can tell, like, when I went in there before, you can see a little portion of the eardrum, and then when it got wet, you couldn't see any of the eardrum. So I end up going to the VA. This is me at the VA Medical Center. And I bought this so this is a medical clamper thing. I bought this years ago, and I had been trying to put this in the ear and grab it, but like I said, it was so flat to my eardrum. So when I got home, I'm gonna see, this is what it was that was stuck in my ear. And I thought I showed you guys the Q-tip that I used. Okay, so the audio got switched around. Okay, this is after I decided to use the long Q-tip and twist, and it came up that far, and then I used my clamp to pull it out. And I was using the video on the app to save it. So this is before. This is out of order a little bit. But this is what actually came out of my ear. This is the clamp that I used to pull it on out. Like I said, I bought this years ago from a gun store. This is a little thing been stuck in there for weeks. I thought it was a sinus infection, an ear infection. But it was flat against my eardrum. Y'all, so these are the Q-tips. I had got these from Big Lots years ago. And I actually had got them for my throat. But these are the clampers. I had bought these clampers from a gun show. And I also bought like a pocket knife. But you see the little gripper things on there? The little grippers? But if I ever see a smaller pair, I'm going to grab a smaller pair. Because this was kind of hard to get in my ear. So I use this. And I was just twisting and twisting it up. I twisted it up until it got large enough for me to, because I measured it against this thing right here. And I was like, this should fit. And once I got close enough, I was able to put this in my ear and grab it and pull it out.